Well, good afternoon, everybody. For those of you who don't know me, I'm Dr. David Sarwer. I'm the Associate Dean for Research in our College of Public Health, and it's my pleasure to welcome you all to this academic year's first Friday seminar series. This series has been in existence, I think, going back to 2016, where we really created it with the idea of finding an opportunity to bring our complementary experience and expertise and highlight the diversity of the programs that we have throughout our College of Public Health. It's taken many different forms. We've had guest speakers, we've had members of our faculty present on their work, we've had representatives from the university come and join us, and working closely with Kim Wing and others, we think we've come up with a really robust set of some novel programming for this fall. And today is actually the first part of a two-part seminar series to kick us off, where we thought, as we prepare to come together in our new building in 2 years, that this would be a really good time to spend a little bit more energy in getting to know one another. That with all the exciting programs and initiatives that we have in the college, we are obviously challenged by geography to come together on a regular basis. And oftentimes we don't hear about the wonderful initiatives that are going on, whether those be clinical programs or educational programs, or those be things on the research side of the street. So today, what we've done is we've asked a range of faculty members from across the college to talk a little bit about the work that they do in their areas. And then we're going to have another panel next week that's also going to talk about the work that they do. But next week, we're also going to do a deep dive into a clinical case. So in large part, a thank you to Susan Kilroy in the Department of Nursing. I am going to be creating a clinical case for a multidisciplinary clinical case for us to wrestle with and chew on, and to hear the input from a range of people, about how we would work together to manage a complex clinical issue. So with that, I'm going to go ahead and introduce all of our panelists. I'm going to ask each of them to take just a moment or two and introduce themselves to everyone. For those of you who don't know them, know a little bit about their departmental affiliations, their areas of interest and concentration. And then I'm going to moderate a bit of a discussion between this panel, probably until about 40 minutes after the hour. And then at that point, we would love to hear from all of you. So if you have questions, you can put them in the chat feature, you can put them in the Q&A feature, or if you're feeling courageous and familiar with people on the panel, if you just want to chime in and ask your question, you certainly could do that. So on my screen, we actually have the perfect Hollywood squares set up. So I'm going to start in the upper left-hand corner, and I'm going to ask Dr. Barry Zumba to pick a circle or square and tell us a little bit about the work that she does.
I'll say circle. So I'm Dr. Barry Zumba. I usually ask people just to call me Barry. I am an associate professor of instruction in the Health Services Administration and Policy Department. I'm also the program director for our health informatics programs. So in health informatics, that's really the intersection of 10 different domains, everything from leadership to information science to healthcare. As a matter of fact, some of our knowledge statements are things like being able to do coaching, mentoring, championing, and cheerleading methods. So we have all sorts of interesting soft skills as part of our program, in addition to, or part of our discipline, in addition to the typical STEM work that we do. I think there's a misconception that we are the computer people. We are the people behind electronic health records, which we are, but we're really an art and a science of that intersection between healthcare and data and information.
And Barry, I learned something there, because I always assumed that the D was silent.
Yeah, it's, they messed it up. My husband's relatives coming overseas, so it's whatever you want to say it is.
Right. Well, Sarwer is a mouthful for many people. I mean, like Zumba, it's 6 letters and doesn't come out quite right. But I always assumed the D was silent.
It can be silent for you, David.
Oh, thank you. Well, I think,
You're welcome.
or we could just call each other David and Barry and go from there.
Exactly.
So, great. Thank you, Barry. Dr. Amy Palumbo.
Hi, everyone. I'm Amy Palumbo. I'm the graduate program director in the Department of Epidemiology and Biostatistics. And I guess personally, I spend, a lot of my time doing administrative stuff and teaching, but when I do research, it's kind of on social epi. So I'm an epidemiologist. Is this where we're talking about what our physicians do?
Sure.
So epidemiologists, we like to think of ourselves as disease detectives, right? When there's a disease affecting populations, we want to know how or why people are getting sick. Epidemiology is one of the foundational sciences of public health. And by examining data about illness onset and exposure to various risk factors and the distribution of both the illnesses and the exposures between populations, we can begin to understand this how and why of disease. And therefore, what can we do to reduce or prevent disease and improve overall health?
I like disease detectives. I like that. Dr. Annie Frankel.
Hi, everyone. Great to be here. My name is Annie Frankel, and I'm an associate professor in the Department of Social and Behavioral Sciences. And like Amy, I'm the graduate program director. So a lot of my time is taken up with administration as well as teaching. And in our department, we have a Master of Public Health program as well as a PhD program. So lots of my time is spent supporting our students, which is probably my favorite thing to do. So my department is a subset of the field of public health broadly, which we'll hear about some more from Dr. Dingman in a few minutes. But our area of specialty in social and behavioral sciences really focuses on health promotion, illness prevention, and barriers to behavior change, not just for individuals, but for communities and for populations. So we focus on health psychology theory and evidence-based practice, and using those principles to reduce health disparities and promote health equity, especially in vulnerable populations. So children, individuals who are incarcerated, there's lots of different ways to define that, but that is ultimately our focus. And some of the work that folks in my department do, there's a broad array of research and other interests, but things like health communication, interventions that are facilitating behavior change or social change, shared decision making, and any way that we can get engaged in the community. So community participation, building community advisory boards, and finding ways to empower and lift up voices. So yeah, it's exciting work.
Great, thanks, Annie. And you know what? With that, I'm going to go right over to Dr. Deirdre Dingman, who's also from social and behavioral sciences, and give her perspective as well. Deirdre?
Thank you. I saw that coming. Yeah, so I was asked more broadly to speak about public health. So public health works to improve the health of communities and populations through research and practice. It promotes behaviors, policies, education, engagement, and interventions meant to compress morbidity into the latest years of a long, healthy, active life for all persons, with an emphasis on social and political determinants and equity. My role in SBS is primarily instruction. I am known for being an advocate for person-first, compassionate approaches to substance use. And I am the faculty supervisor for an up-and-coming chapter of Students for Sensible Drug Policy here on campus, which I'm really excited about.
That's neat. I may come back to that, Deirdre, so you can talk a little bit more about that. That was something I was unaware of, but that sounds like a great opportunity for students who are looking to get involved. And we actually have a third member of the Department of Social and Behavioral Sciences, Dr. Elizabeth Tennyson, but she actually heads up our nutritional sciences program. So Libby, do you want to talk a little bit about your role?
Yes. So I'm Dr. Elizabeth Tennyson. I'm an assistant professor of instruction in the Department of Social and Behavioral Sciences, and I am the program director for the MPH in nutrition. So I do all the administrative work to train students to become registered dietitians. with a NPH in nutrition, and they're a registered dietitian. So I am a registered dietitian myself. And as a registered dietitian, we consider ourselves to be the nutrition experts. And we work in all kinds of patient settings, populations, using evidence-based practice to bring the best nutrition intervention, whether that be with preventative nutrition, functional and integrative nutrition, interventions and programs in population groups. And as I mentioned, it can be all kinds of settings, from performance nutrition with pilots in the Air Force to your local grocery store, to research settings, to the typical settings in hospitals and extended care facilities. The field just keeps on growing.
Great, thanks, Libby. And then let me turn over to Dr. Rejay UCL, who's also in the Department of Epidemiology and Biostatistics, easy for me to say today, with Dr. Palumbo, but actually has a bit of a different focus. So Rejay.
Sure, thanks. I also have a difficult time saying my own discipline name. So I'm at the Department of Epidemiology and Biostatistics. I'm a professor of biostatistics and also program director of our new master's degree program in public health data science. So a lot of people ask me what it means. So it's not that easy to say what we do, but I'll give it a try. It's a super entertaining field. The dictionary meaning is a branch of statistics that deals with data relating to living organisms. So it's really kind of, I feel like almost vague, but we try to make sense of all the data. So our job is to really turn data into knowledge that impacts our daily lives, whether it's in the form of policy, what medications we are going to take, what to watch, or buy in Netflix, Amazon. All those stuffs are really based on some statistical methodology, unfortunately. So don't blame us, like treatment effect and so on and so forth. So what we do is that we use tools in statistics and help answer research questions that are in a wide variety of fields, such as medicine, biology, public health, and such as whether the new drug works, what causes cancer, like unraveling relationships between environmental exposure and disease, how long a person with a certain illness is likely to survive. It just ranges from many different types of questions. So I'm really happy to be in this field because we get to learn a lot of different things in different fields. And sometimes those problems motivate our own research, where we develop methods that improve current methods, or really offer a solution that doesn't exist based on those problems that really come from other fields. So it's really great to be in this field because we get to see we actually help to better population's health. So that's about it.
Great, thank you. And then last but not least, Dr. Gabriel Taju, who represents another department, but is also I didn't mention that I'm also a member of the Department of Social and Behavioral Sciences faculty. And in fact, Gabriel and I collaborate on a lot of projects. And so one of the things I think we're going to talk about as a panel are the ways in which we come across our departmental lines and actually interact with one another. But with that, Gabriel, why don't you introduce yourself and tell everybody a little bit about your work in your department.
Yeah, thank you so much for the introduction. And my name is Gabriel Taju. I'm in the Department of Health Services Administration and Policy. I'm an associate professor. Dr. Zamba and I are in the same department, just different divisions. But theoretically, I'm a health services researcher. In practice, I would say I'm more of a epi researcher or social science researcher generally. But I'm in the Department of Health Services Administration Policy, and health services research pertains to how healthcare is accessed and delivered. So sometimes you can ask the question, what is health services research? And a rebuttal could be, well, what isn't it? It really has to do with so much, but when you get down to it, it theoretically should be about how healthcare is accessed and delivered. Often the outcome variable is not a clinical outcome. So for instance, health services research may be more designed to look at hospital quality, which may be measured with different things like patient satisfaction, looking at 30-day readmission rates, access to care, how processes are implemented in a health system, et cetera. Oftentimes we'll look at how policies impact outcome variables that may be clinical as well, and use different tools and techniques like econometrics to try and account for national, state level, time level trends, to not be making causal statements, but get closer to a statement that policies work or do not work based on statistical methods of econometrics. So I also do cost effectiveness research, which cost effectiveness research is a part of health services research. I have experience in this area as well as in cost calculations. And then I did also complete a postdoctoral fellowship in hypertension and cardiovascular disease epidemiology. That really informed my work a lot. And my work since has been attempting to bridge the gap between health services and epidemiology research. I claim that I'm a cardiovascular disease risk reduction researcher. I've done research with David on the effects or the association of bariatric surgery with hypertension and blood pressure following surgery. And then also I've done more recently, my research has been utilizing electronic health record data. So this is how I'm trying to harmonize the two worlds. So utilizing electronic health record data and machine learning methods to optimize care for adults with hypertension or diabetes.
Great, thanks, Gabriel. So my first question, Amy, I'm going to start with you, but I think almost everybody probably can chime in on this. So, you know, when I think back to when I was in high school, didn't know what epidemiology was. I don't think, and I definitely didn't take any courses in it as an undergrad. But I feel like, you know, with the pandemic, epidemiology as a discipline kind of had its moment. And, you know, many more Americans learned what epidemiology was, the role that it plays. I've actually said this to students. I think I said this to my students the other night, that if I would have known before I went to graduate school in clinical psychology that what epidemiology was, I may have ended up being an epidemiologist, because the way you all think about things actually resonates with how I like it. But what's your kind of take on how students find and get exposed to and drawn to epidemiology? And again, I think I could pose the same question to probably just about everybody else in this panel, which is, what is your experience in watching students? And, you know, is it that some, you know, all of a sudden you see the light bulb in their, you know, go off over their heads, or the twinkle in their eye that they kind of get it? But how do students find you as a discipline?
Well, I think I'll start with talking about maybe a little bit of my own experience, because I also came from not a public health background, but I gravitated towards data and making sense and being comfortable in that. So I think one thing about epidemiologists, and of course about biostatisticians as well, is that, you know, I had a job where I was working, you know, kind of doing data analysis, but it wasn't meaningful to me. And then I, you know, kind of found public health and found that I could work on this back end to solve problems. And it really was this idea of being a disease detective, like really was like, oh my gosh, that sounds so exciting. And I can use numbers to do that and make sense of numbers in a way that can help people. So, I think that's, one way that people can get into it. If they're already in public health, then, one of my goals as an instructor is to, hopefully help people see, how all the data, we have so much data out there available, and how we make sense of it, right? So epidemiologists are all about like designing the right study and looking at things the right way. And so if, I like to try to get people excited about that aspect of it. And that's, I think, a good way to get into this part of public health.
Do you, when you look back, I mean, were you always like a numbers person? Were you always drawn to math and kind of thinking about the world numerically?
I was, but I say this to a lot of my students who, because I get some comments, especially from students that are not, not in our department, and they're like, I'm bad at math, like I was like, I don't think so. I think, because I think one thing about epidemiology, or at least like, data in public health is, it's just like a way that you approach it. And so kind of shifting your mindset, even if you think you're bad at math or bad with numbers, maybe you just haven't gotten excited about it yet. So, I mean, but I have always liked data.
Maybe I can jump in, since a lot of
Yeah,
data.
please jump in.
Mine is completely different. My PhD is in statistics, where people try to find problems. They create problems to work on. So while I enjoyed statistics and more theoretical aspects of it, it wasn't really all that meaningful to me either. I mean, of course, you get excited about solving problems and everything, but until I did my postdoc at Harvard in healthcare policy, I started learning how you can actually communicate using these statistical tools to stakeholders, whether they are, doctors or academicians or actual consumers of these methods. I find that extremely rewarding. And then throughout my teaching career, I've seen a lot of students who get really intimidated by math, just like Amy said. But we reached to a point where in our lives in academia and the technology and everything, math doesn't need to define your experience. So, if you understand the substantive meanings of the findings, and if you understand the impact that you might play in linking the results to daily lives, that's what you need. So I find that extremely rewarding. Since I came to Temple, for example, a lot of students come to my office and say, look, I want to do this, and how should I start? So I just met yesterday with a student who wants to do biostat degree program, whether it's public health data science or applied biostat. And when I asked, why are you interested? She said that she was really excited because of an instructor. So that's where we really need to play a role, getting students excited, because this is I always tell them this is where things are going. Even though we have supposedly threats from generative AI and everything, but I think they are going to help us even more. So I think from a classroom experience, students might be really interested in these fields.
And I'm going to jump on to this, since we're hearing data from epidemiology, data in data science. And so, I think that confuses some students, because I see students who, before they even apply to the program, they'll come talk to me and say, well, what exactly is the difference? And I would say with health informatics, we are very broad, where, as Amy said, she's a disease detective. And as Reggie mentioned, it's all about, in statistics, it's finding problems and applying that to everyday situations. We have 10 different domains, and health information technology and information science are just 3 of those. Some of our practice knowledge statements include things like negotiation, collaboration, legal, regulatory, and ethical issues, business process modeling, and knowing the similarities, the differences, and the dependencies across the health system domains, such as healthcare delivery, health policy, public health. So one example is we have this large 5-year CDC project. It's not really research, although it feels like it. It's considered public health surveillance. And Regi is on there. We also have some folks from epidemiology. And what's interesting is that we're getting students involved, and we're creating all of these opportunities for more informatics knowledge. So there's 3 very specific projects happening now. One with a PhD student, one with a graduate student worker, and one with an MSHI graduate who is now in a staff role. One is what we call extraction, transformation, and loading, because in informatics, we have to collaborate with the health system. We don't have access to go in there and pull protected health information. We have to work with an honest broker over there. And then that data comes to us, and it's very messy. And then our version of an honest broker has to create this ETL process of transforming that data so it meets the right requirements. And then we have, as part of this CDC surveillance project, an active surveillance component where we have a student worker that created what I'll call like a mini electronic health record for 2 chart auditors who have experience as clinical providers, nursing, and physical therapy. And when we have an issue that needs deeper investigation, they have access to actually go into the actual full medical record, gain information from there, add notes into this database. And then we have a third person, the staff member. We just found out recently that we have a huge address issue. So when we try to geocode patient addresses, we know we have issues like the homeless population. We know that sometimes if we see an address that's the same address as a hospital, that they are most likely homeless. But we're starting to see addresses for other locations, things like just the zip code or a post office box. And so we have opportunities to look at how do we improve the data that can then be used for data science or for epidemiology. And sometimes it's a manual effort. So in the case of fixing addresses, sometimes there's a typo, and it's a matter of going into Google and looking for the AI in Google Maps to give us the right address. Other times it's investigating things like we're seeing a lot of patient addresses that are post office boxes. And this is where, in the future, it would be nice to have someone from SBS, because, my guess is something changing in the neighborhood. We know there's been a lot of mail theft, for checks. Are people giving their addresses now as post office boxes? Is that a valid area? And we're taking this data and we're geolocating it, matching it up with social determinants of health data at the census block group level, so that the epidemiologists can do their analysis on there. So, it's interesting to see all of the different disciplines across the college and how some are narrow, some are broad, and how we complement each other.
Yeah, and I'm just want to chime in here for a second, Barry, because it's interesting. I heard a couple of different things as you were speaking, which I think want to make sure that, particularly for the students who are listening in, picked up on. The first is what you were just touching about, which is the multidisciplinary nature of your work. And it's interesting, I saw Annie's head nodding. I was kind of thinking the same thing of, that the issue of the PO boxes and the missing address is absolutely a social determinants of health issue. And, finding way, that's the beauty of sessions like this, is to bring us together to talk about and think about ways that we can bring our complementary areas of interest together. But the second thing that you were talking about related to those individual student projects is, I think particularly for our first and second year students at the undergraduate level, they see our role as faculty members as what are we doing in the classroom and what are we doing in office hours? And I think so much of what we do with our more advanced undergrads and ultimately our grad students is non-classroom based learning. And so it's the opportunity to give them a chance to work on a project, develop a new project, answer a question. And it's almost the proverbial toe in the water of, well, how much do I actually like doing this, not just learning about it? And is this therefore maybe a career path for me? So I hope as people were listening to you, they also picked up on that, because I do think that, you know, when students come to us, you know, Reja, you talked about office hours yesterday. You know, when students come to us, for many of us, that's our favorite part of the job, is our interactions with students outside of the classroom. We get to work with them one-on-one and inspire them and talk to them about what they want to do professionally. So I want to turn this issue upside down a little bit, and I want to hear from Annie and Libby and Deirdre more about kind of social and behavioral sciences issues. Because I think for many of us who work in those areas, you know, there's a lot of that lived experience. You know, I'm a human being and I know people who have struggled with this, that, or whatever, or I've been challenged by this. But tell us a little bit, the three of you, about, you know, how you find that students get engaged in whether it's public health more generally or more specific disciplines under that umbrella of social and behavioral sciences.
Yeah, I can go first. I appreciate that. And I appreciate, David, how you said, you know, something I hear sometimes from students is, isn't social and behavioral sciences everything? Doesn't that capture everything? And I was like, well, you know, that is fair. It's fair to think that way. But what I like to think of us as is connectors, right? We can pull together pieces from different places to help solve problems in practical ways. So, you know, as Amy and Rajai and Barry were talking about, you know, housing and data, we can't exist without that data, right? We don't know what the needs are in our communities and our populations without that data. So we rely so heavily on the work that's being done before the data comes to us. And I think what social and behavioral sciences does is translate and start to practice, what does this look like in a community? What does it look like out there? And I think one of our benefits, to pick up another piece of what you said, David, is that our students get a chance to be out there in the community, understanding what the needs are and what we can do about them. So for something like housing, you know, I could have an MPH fieldwork student investigating what's happening in those zip codes or in those addresses, and whether maybe that organization who's collecting that data needs some resource connection to someone who can understand the housing needs, connect them with a community-based organization that does housing so that they can meet the needs that are emerging through the data. So that's kind of our piece, is pulling up those needs and linking them to community resources through evidence-based practice and research. And then on the other end, our friends in policy can take the things we're practicing and translate them into systems change. In a perfect world, right? It's a little bit messier than that in practice, but that's essentially where we sit, is in that connectors. And I'll pause for a moment because I know that Libby and Deirdre can add to that, but that's how I see it.
So I can go next. I think to your point of the lived experience, especially in nutrition, because it is a specialized field, many students are drawn because they've had an experience of their own, either personally with a childhood disease where they had to alter their nutrition, or a loved one that had to alter their nutrition, or perhaps they're an athlete and they recognize the importance of nutrition in their performance. And so they're just kind of drawn to it because this is something that, you know, they've kind of had a hobby around, or have seen someone impacted by improved nutrition. So that kind of draws them into the field, and they may come to the program really knowing that they want to do something to help others, you know, like they were helped, or to improve nutritional status. And then it's really opening up the eyes of and the world to the student with, as David has mentioned, some of what I call soft skills, those experiences outside of the classroom where, they work with our core researchers and they learn some research skills. They develop rapport with patients, or, we put them out in the community settings. We give them opportunities to do research. And as Andy mentioned, they send out a survey via email and no one answers and they wonder why. Why did this happen? Or they mail them out and no one responds. And being able to draw from, what has been set in place. And as you mentioned, those social determinants of health. Well, they only have a PO box.
Yeah.
They don't have access to their computer. They don't have a phone anymore. So it's kind of like the seed is planted in them, and the beauty of our program is that it can really open their eyes to all of the possibilities. I've had students come in and say, I want to do XYZ, and then throughout the 2 years, they find and stumble across something, because of all of our field work and our experiences at Temple Health and just other things we do for them. They really find something that really sparks their interest and are able to pursue that after they leave Temple.
Okay. Deirdre, what are your thoughts on this topic?
I kind of have a case study of bringing it all home. So one of my most popular classes is my substance use and society class. And we talk about the drug war, the contaminated drug supply, a lot of stuff we get from epidemiology, surveillance of the drug supply. But I had a student last semester, and I have a student every semester that's really interested in the topic, but this one kept coming to office hours to talk about different things we brought up in class. He would ask very good questions, and he is the one who started the Students for Sensible Drug Policy chapter, which the focus of that chapter is to have honest discussions about drug education, drug policy, to advocate for harm reduction and those type of policies. So I think they're taking it from class, thinking about the broader society, definitely Philadelphia, what's happening here, and wanting to make change.
That's great. So if I have one more question for our panel. But for those of you in the audience, we've got a really nice turnout today. If you have questions or comments, feel free to either put them in the Q&A feature of the chat, or when we're done wrestling with this last question, if you're feeling courageous and want to chime right in, you're certainly able to do that. Tell me a little bit. I'd love to hear each of your perspectives, and Gabriel, I'm going to let you go first. Do you see yourself more as a disciplined person, or do you see yourself more as a disease person? So my discipline is I'm a clinical psychologist, but a lot of people don't know that. But I work in the area primarily of obesity. So a lot of people see me more as an obesity guy, which means I spend a lot of time with physicians and dietitians and nutritionists and exercise physiologists. Then they see me as being a disciplinary guy with respect to being a psychologist. So just happen to be a psychologist who works in an area. How do each of you see yourselves, and does it matter?
That's a very interesting question. And I think my thoughts on this likely have changed over time. I think there's definitely a set of individuals who have an extremely strong methodological approach that can be quote unquote applied to everything, right? Like I could do cost effectiveness research on anything. I could use cost proportional hazards modeling on anything. I could theoretically use my machine learning background to, at least inform something to predict. I think that, and this is maybe more career development than anything, but I think that one thing that I've been excited about as I move forward is having more of a focus. So I do hypertension research, I do cardiovascular disease research. If it touches on those subjects, I'm probably pretty excited about it. I think though, as you start getting further in your career, the time demands increase. And so I think it's important to have a focus on the what you are doing, in addition to being open to collaborating across disciplines with your skill set. But again, this is just something I've been kind of feeling lately, is that I've only recently got a few things from my postdoc off of my plate, like a year ago. So I think that from a career development perspective, being open to using your methods across disciplines is a good strategy, but also beware. Don't spread yourself too thin. So now I have a nice little cadre of things where I can claim that I know what I'm talking about. For instance, there was a situation where I had another first author publication, and what that allowed me to do was completely add a new section to my bio sketch, right? So the point I guess I'm making is that make sure that you do collect enough different areas of expertise along the way, but also consolidate. So personally, I think that to answer your question, you can have your methods applied to different fields, and that's great. And if you're collaborating with people that you love, that's great too. But practically, I've been more thinking about this idea of honing down into a few certain specific areas.
What about the rest of you?
So I'll jump in there, David. I feel like over the past 10 years, I mean, I'm definitely a disciplined person, and not disease specific, since I don't have a clinical background, but I feel like I've collected diseases over the past 10 years. From my first project, which was idiopathic pulmonary fibrosis, I still remember the ICD code. And we do things like one day, I could be working on an Alzheimer's project. Another day, it's something around genomics or precision medicine, or now COVID. And so, in our field of health informatics, you have to be willing to embrace the uncertainty, because you just never know what disease you're going to end up supporting, because it is such an intercollaborative discipline.
I like the phrase, I'm collecting diseases, which
Yeah.
I'm sure the epidemiologist would say is probably not a good practice to be in.
Yeah.
But what about the rest of you? Because I'm also going to bet, kind of along the lines of what Barry just said, that sometimes over the arc of your career, it can change.
Sure.
I mean, is anybody, Deirdre, I think about when you and I first met years ago, you were doing some work in nutrition, and then you were doing some stuff with our colleague Heather Murphy on hand washing, and now you've kind of found your newer home having to do with substances and drug policy, and it's a beautiful merger of your instructional interests as well as your research interests, but and yet, sometimes when those things happen, we never quite see them coming either.
I was just thinking the same thing when when you said that. But before I got my doctorate, I practiced as a tobacco treatment specialist. So I wanted to get away from that. And then my doctorate was focused on obesity and nutrition related stuff. And I wanted to keep doing that. That's when I met you. And then I think Steve, he's on this call, hired me as kind of a generalist. And so I started teaching and learning about all different things. And yes, full circle, substance use and harm reduction and reducing stigma does seem to be the passion that I'm settling into now.
Mm-hmm.
I'd have to say that I think I'm a blend, because I feel like now at the point in my career, I'm a nutrition, health, and wellness advocate. And I feel very passionate about that. So in my role as, as an educator now, I'm trying to really inspire the next generation of practitioners to, embrace that as we, move forward, functional integrative medicine, prevention of disease.
I'll
So
throw
we've got, go ahead, Annie.
I was going to throw my hat in the discipline bucket. I like to see our department as a series of skills, and certainly the Master of Public Health is a series of skills that you can apply in a lot of different areas. And it's one of the favorite parts of my job. I like to say I have like, the nutritionists will probably not appreciate this, but my hands in lots of different pies, because you can learn a little bit about a lot of things and apply these skills, which it just never gets boring.
Yeah, I would agree with that. And I've never done this, and I always think that I should. I would love to go through not only the entire college, but even just our department, SBS, and look at the different degrees that are represented. We have people with doctorate degrees or master's degrees in a wide range of disciplines. And it's one of the reasons why I raised the question, because I do think that sometimes from the student perspective, there can be a little bit of tunnel vision of, this is the next step to this, the next step to this, and not realize, particularly if you become more of a disease person, if you will, that it's a multidisciplinary approach. And that's one of the awesome things about what we do, right? Which is that we get to look at discrete issues from not only our own perspective, but shared perspectives from other people and learn from them along the way, which is probably one of the reasons that we're all working in an academic setting, because we embrace lifelong learning. So we've got a couple of great questions that have already come in. So let me pose that and make sure we get to as many of them as we can. So one question, and I like this one a lot. As a freshman, so first of all, welcome to campus and welcome to the college. How can we dip our toes into the different realms of public health to figure out what we are most passionate about? What do you suggest in order to discover what we want to pursue? And then in parentheses, as someone who is a health information management major, but I'm worried that this isn't what I want to pursue. So Barry, you can take the first stab at convincing our student that HIM is a great area of concentration.
So I could tell you about the starting salaries. That's probably the number one thing. But you have to enjoy what you do, Allison. So I would say that you'll have the experience in a database and analytics course where you'll learn about some of the other disciplines because of the data. But there's also other things. It's just getting involved in the college. There's so many events and experiences, and that's where you'll meet people and talk to other people. There's badges that you can go after in Suitable. And so I would say the more that you get involved, don't be afraid to look up a faculty member on the College of Public Health's website and send an email and introduce yourself. I know, I don't want to speak for everybody, but I know many of us are willing, we'll take a walk with you over to get coffee or, lemonade, or just walk through campus and answer any questions that you have before you take that move of going to the registrar's office, changing your major, because sometimes you can't easily undo that. So I would say reach out to us and to current students as well.
Yeah, I think that's a wonderful suggestion. Ray-J?
In addition to that, I was going to say that ask faculty members if you can shadow. So, especially for outside classroom experience. So we, as you can guess or understood from this conversation, we are very interdisciplinary. Every one of us work with each other in some fashion. So that is a great thing to witness, to see how we communicate, how our methods that we develop help each other. So reach out.
And Dr. Wendy Cheeseman, who is heads up HRPR 1001, is reminding all of us, rightfully so, that that's a great opportunity to really understand the landscape of all the disciplines within the college. So many of you are in that class right now, and I think throughout the semester you're going to find that again is a great opportunity to learn. But I would really echo what was just said. I do think there's this perception that we are, as faculty members, not approachable, and I think sometimes because of the way higher education has evolved, particularly with respect to advisors, some of us went to college decades ago where your faculty members were your advisors, And you didn't have this layer of advisors who were telling you which classes to take. That'd be what a faculty member would do. But again, a lot of the reason why we're here is because we very much enjoy working with all of you and find it very rewarding to, you know, watch that twinkle in your eye and see you get excited about a given area, and then watch you, you know, stay within our majors or our areas of concentration, and then walk across the stage at graduation and go on to great things. So, you know, please do hear what my colleagues are saying with respect to reaching out to us, and whether it's an email or coming by during office hours. I think that's a really great way. Another really interesting question that came in: is it possible to take a business or corporate approach to public health?
I'm just gonna chime in here, David, because one of the other departments, one of the other divisions in our department, at the graduate level is health policy and management. So while not your typical business corporate, you know, the way you would run Amazon, or Target or Walmart, there is an opportunity there to take some leadership and management courses at the graduate level, but also there's some undergraduate courses in health policy that involve the business of health insurance. And so, you know, if you're looking for those courses and can take electives, you know, they typically start with the subject code HPM.
Mm-hmm.
I just want to add that it's actually really important for us in the field of public health to be incorporating business principles into what we do, right? There are so many nonprofits out there that need strong management and leadership and experience creating budgets, because we know the principles of doing good work in the community, but sometimes we're missing that business piece. So when I have students that come into the Master of Public Health with a background of business, I always see that as an amazing opportunity to further the work that we're doing in a way that we can make sometimes more profitable than it is, because it's very difficult to always rely on grant funding. It makes our work hard to do. So yes to business in any way that we can figure it out. Yeah.
And Amy, you were going to say something?
Oh, I was just going to echo that and say, like, in addition to that, like thinking from like, I have an undergrad degree in economics, and I'm interested in social epi, and, you know, how much people's local and personal economics kind of influence health and health decisions. I think we can't ignore, you know, how, you know, yes, the business approach to public health, but also how businesses and the economy just like are embedded within public health. And so having an understanding of that and being involved in that part, you know, public health is so wide ranging that, yes, I think there is an approach that can be part of public health.
And I would just add to this, you sometimes find people with a public health background in places that you wouldn't necessarily expect them. And the first example that comes to mind are major pharmaceutical companies. You know, a lot of what they do is, how do we figure out strategies to get our medications to the greatest number of people? I have a good friend and neighbor whose wife actually is in Washington, D.C. today, who works with a pharmaceutical company, and she's a specialist in access to care issues. And so she's actually on Capitol Hill talking about how do we maximize access to care for high impact cancer drugs that sometimes get caught up with high price tags and therefore may not be available to the largest amount of people. So we sometimes forget that there are public health professionals who can work in a variety of different disciplines and bring that very valuable perspective to that industry. So we've got two more, and I'm going to save the fun one for last. On the flip side of this, and the broadness of what we do, how does a student avoid tunnel vision? So this student is actually very certain about her career path, I believe, but actually doesn't want to inadvertently slam the door on other opportunities either. So what would your advice be in a situation like that?
I'll jump in, because I actually think it's the same as somebody who doesn't know what they want to do. I would still encourage everybody to, use this opportunity while you're here to expose yourself to as many disciplines and as many kind of aspects of public health as possible, and get a sense. And one thing we recommend for our MPH students is that they do informational interviews. So not just meeting with faculty, but maybe there's somebody else, doing public health, in the community or at, a health department, and they just want to, you want to understand more what their day-to-day is like. So just take as many opportunities as possible and learn what everybody does. That's my
And
thought.
that doesn't have to necessarily mean a drastic change in your career path. So you're in a college where you can learn a lot of different things. Focus on your career path as you wish. There's probably reasons you started out that way, but also try to get into other fields, at least learn their fundamentals, because that's always going to help you.
All right, so last question, and this is kind of a little fun. If you could collaborate with one other discipline in the college that you're not currently collaborating with, who would you most want to connect with?
I'll go first. HSAP and social work. Can I pick two?
You can pick two.
Why not us? Heartbroken.
What would you like to do with HSAP?
I don't, so many things around drug policy and maybe tracking who's using the opioid settlement funds and how, and best practices. And so should we connect later? Because again,
There's a couple people in the department that would do that.
okay, cool.
What about the
I was
rest of
gonna
you?
say something like urban planning or something even outside of the college. The question was about not just in the college, right?
I think it's, I think there's value to be saying, are there other people across the university?
I might have misunderstood. Anyway.
No, I did say college, but I think, the answer could be throughout the university as well.
Definitely policy for me.
Yeah, I would definitely say, and I'm fortunate that I was able to do it, which working with Gabriel and other people in HSAP over the last several years has brought a dimension to my work that didn't exist before I joined the college. And I so enjoy that. And I think it's one of the great things about the college is that, and it kind of goes a little bit back to the degree versus the discipline versus the disease question, which is many of us have that great luxury of being able to find other collaborators who look at a given issue from a slightly different perspective. Any last closing comments from any of you?
We didn't talk at all about our clinical programs. Can I put in a vote for those being the ones that we collaborate with? Because
you certainly can, because it's going to be a great segue to next week.
That's right. That's right. I mean, seriously, we do a lot of, we have a lot of community experience and that's what we build off of. But when I have students in the classroom that are doctorate and athletic training students that already have nursing degrees, are physicians, are studying, rec therapy, there are so many different clinical disciplines. And these are people that are seeing the social determinants of health every day in their clinical work. And so it's invaluable to have those perspectives in the classroom and to do what we can to all work together.
So
I think rehabilitation and health and rehabilitation sciences could be a good one too, and
Yep.
nursing.
So first of all, let me thank my colleagues for joining this discussion. It's been a great pleasure for me to host these events largely over the last several years, and a few of them stand out as being some of my favorites, and this one has already shot to the top of the list. It's great to hear the passion for what you do, the kind of philosophical underpinnings of why your discipline does what it does and what it values. And I think this session was just such a great gift, to our students, to our staff, to our faculty, to remind us of the ways that we can come together. So I thank you guys for wonderful contributions. I also want to remind you then, and it's going to come up on the screen in just a moment, for those of you who have joined us today and are looking for credit for Suitable, the QR code will pop up in just a minute, so you can go ahead and scan that. And then building off of Dr. Frankel, so you can scan the QR code there for your Suitable points. So next week is essentially part 2 of this discussion, in that we're going to focus a little bit more on some of our clinical disciplines. We're going to get other members of the college faculty to join us. But what we're also going to do is we're going to do a clinical exercise together. So you in the last couple of years, if you've been within our college community, you've heard an awful lot about interprofessional education and the ways that we work together as multidisciplinary teams. And so you're going to see an example of how our clinical disciplines would come together around a clinical case that, while disease specific, has significant public health overlays. And I'm already anticipating that next week is going to be as fun and engaging and rewarding as this session has been. So again, let me thank my wonderful colleagues for kicking us off on the right foot. Enjoy the weekend, everybody. Stay cool and comfortable. Go Eagles if you're Eagles fans. And we'll see you all next week. Take care, everyone.